So the same thing about informed decision making. The assumption here is that at least you have to have the information before you can make the decision. Right? So a few years ago we did a study and we found out that 30% of the people who were cancer patients, 30% of the people who had a history of cancer never looked for information outside the medical encounter. Right? This is important. So how can they not do it? It is so important to get information because they're going to make these decisions. What kind of treatment? What are the consequences of it? So we, in our own arrogance and ignorance, we call them the non-seekers, right? Information non-seekers, and we even published a paper on that, which attracted some notoriety. So there are 30% of the people are non-seekers of information. Then somehow we started thinking about it and said, this is ridiculous, whether you're poor or rich, you seek information, you do feel the gap in information, right? So we are doing something wrong here. We are not looking at the right thing. So we went back and did another survey. We said, okay, so, and this is information outside the medical encounter, okay, not with the provider. So we said, okay, what kind of information do you look for? Whether you're looking for information or not, what kind of information? That's when we started, when we found out how wrong we were. So when it comes to information on treatment, self-care management, pre-treatment information, the classical medical information, indeed you find differences by socioeconomic status, right? The more educated you are, postgraduate, college, high school, and less than high school, the more likely you will be looking for medical information to complement what your provider has provided, right? So you have this discussion with your doctor and then you say, you know what, I might go out and get a second opinion on this. Reasonable thing to do, and that's what, if you have more formal schooling, you do, right? On the other hand, when we ask them, are you looking for information on work or finance? Now you see, this is wealth. Actually, this is wealth. So people with lower wealth are more likely to seek information on work and finance compared to people who are higher in wealth, right? People who are wealthy. And we also actually have data on debt. The level of debt influences what kind of information you look for. So higher your debts, the more likely you will be looking for information on financing and work. It makes eminent sense. If you're a cancer patient, you have to start negotiating with your supervisor. I have to take time off work, right? Because I'm undergoing treatment. Or 1/3 up to 30 to 50% when you're in a certain socioeconomic spectrum, 30 to 50% of your debts are because of medical bills, right? So you have to start thinking about loans. How do you really feed the family? So it's reasonable to think that's the kind of information they're looking for. So that's what, it's not that they're not seeking information, they're not seeking medical information because they're fairly satisfied with what their provider is giving. It is this other kind of information which they need. So what the whole point of my argument is that class matters, race matters, place matters when it comes to communication of health and reception of health.